Building a better Bay Area. Moving.
She usually gets here right on time.
Building a better Bay Area. Moving forward, finding solutions. This is ABC 7 News.
Hi there, I'm Kristen Z. You're watching Getting Answers live on ABC 7, Hulu Live, and wherever you stream. We're asking experts your questions every day at 3 to get answers for you in real time. Today, celestial happenings. You're in for a treat if you look to the skies this week. A near total eclipse of the moon will be visible, and our favorite astronomer, Andrew Fracknoy, will be here to help you make the most of the viewing. And even as 5 to 11-year-olds begin to get vaccinated, some California school districts are already saying they will defy the state vaccine mandate for students, even if it means losing money. A UC Hastings law professor will break it all down for us. But first, new information on booster eligibility changes, long COVID, holiday travel risks, and whether vaccines are enough to get us out of the pandemic. Joining us now to discuss this and other topics, UCSF infectious disease specialist, Dr. Monica Gandhi. Dr. Gandhi, nice to have you here.
Thank you.
Oh, by the way, folks, if you have any questions for Dr. Gandhi, maybe you're not sure if you should get a booster or whether you should get your child vaccinated, you can post your questions on our Facebook live stream. All right, Dr. Gandhi, the FDA plans to authorize the Pfizer booster for all adults as soon as tomorrow, not just the over 65 or those with health concerns. Something the Biden administration has, of course, been pushing for since August, and California has been officially sanctioning it for over a week. Some doctors now say it was a big mistake for the FDA and CDC to limit booster eligibility initially. Do you agree?
I don't actually agree with that. I think that the process that the FDA Advisory Committee went through on September 17th, when they deliberated about boosters for all versus boosters for selected groups, was extremely thoughtful, reasoned, and they had very good reasons they put in data slides about why they're only authorizing this for over 65-year-olds, including 74 studies from around the world showing the two mRNA vaccines are above 90% effective against preventing severe disease in 74 studies across the world, including those in the United States. So I think it's political. I think there was a lot of back and forth. The president wanted this, some of his advisors wanted this, and at some point the FDA is just going to say yes. But actually there was a very well-reasoned process why they limited the groups for selection.
All right, as you know, in the Bay Area, everyone's trying to get an appointment. They're kind of hard to come by. But it sounds like from what you're saying that if you're a healthy 30, 40-year-old with no health concerns and you're not working or living in a higher risk environment, you would probably just pass on the booster if you got your 2 original shots?
Yes, and the reason I say that is that there was data from New York State that came out after the FDA meeting that looked through all their Medicare recipients and also as older people, and then they looked through anyone else who had insurance who were younger. And the vaccine effectiveness against severe disease, against hospitalizations, was totally persistently high for Moderna and for Pfizer up to the age of 65. It was only after 65 that you saw with the Delta variant decreased effectiveness, only in over 65s. And then of course the Johnson & Johnson, anyone who got a first dose should get a second dose. So I think this is a little bit like, what do we do? I'm gonna try to figure something out to reduce transmission. And frankly, getting the unvaccinated vaccinated is what will decrease transmission. This is unlikely to make a change.
All right. Despite what you're saying here, look, I mean, here in the Bay Area, a lot of people are still struggling to get a booster shot just because they want it. And some people are having a hard time, right? And they're wondering if they should lie, right? Because some pharmacies are still going with the CDC for now, right? And it hasn't eased the booster restrictions yet. It might tomorrow. But others, because their websites haven't yet caught up with the rapidly changing rules, right? So including the states, my turn. So do you have some thoughts on the ethical question for people who really want it, you know, as to whether they should lie?
You know, at this point, we have ample supply for everybody. This is not something that the United States decided to figure out how to help with global vaccine equity. So there's ample supply. You could easily lie and put in that, you know, you're in one of these groups and get it. I mean, I think that it's past the point of our doses going abroad. It's just they're going to go to waste otherwise. So I think that's absolutely fine to do that. I do think it's safe. And I don't see any contraindications to getting a booster.
Okay, great. A couple quick questions from our viewers here. Randy wants to know, if I had a reaction to the Moderna vaccine, would you recommend a booster of a different kind?
Yes, and in fact, I wouldn't recommend Pfizer for you because there are certain elements, something called PEG and other compounds that are in both types of mRNA vaccines. So if you want a booster, I would get the Johnson & Johnson for you.
Okay, Colette wants to know, I got the Pfizer booster and had 100-degree fever, chills, aches for 3 days. I was fine with the first 2 Pfizer shots 8 months ago. Was this a bad thing that I had such a bad reaction to the booster?
It is not a bad thing. This is what happens with really increasing your antibody levels, that you may feel ill for a couple of days. This is actually why the FDA Advisory Committee didn't want to approve boosters for all, just as a comment. They didn't want people to get adverse effects if they were fine with their immune system. But luckily that passed. And yes, that's what's going to happen. Possibly if you already have a high immune reaction, you may get some side effects for a couple of days because you're increasing it.
Vivian wants to know, will my 17-year-old type 1 diabetic get a booster or a 3rd dose of the Pfizer? He is at school in person. It's been more than 6 months.
This will not be approved for a 17-year-old, actually only above 18. And that is because there is an increasing risk of some adverse effects with young males. And so this is not going to be something that's going to be approved for 12 to 17-year-olds yet. And I think that's the prudent decision. We don't want side effects like myocarditis for a theoretical benefit.
All right, Gretchen wants to know, right now, I need the flu shot and the booster. Which is the most important to get first?
You know, there was a study in the UK that said it's fine to give both of them. Now, that was on adverse effects and also antibodies. It looked like the antibodies went just up. If I had to choose, though, I would get the flu vaccine in front of a booster if you are not above if you're not over 65, because flu is coming back. There's a big flu outbreak at University of Michigan, and we want people protected against flu. And you're likely already protected with COVID with your 2 shots.
Is it a bigger worry for you that we're hearing a lot of people now are reluctant to get their flu shots, right? And that a lot of children haven't gotten their measles shots or childhood vaccines as a result of how people have responded to the COVID shot?
In fact, I'm extremely worried. And this is, again, partially why if you just, all you have to do is listen to the FDA meetings on September 17th and October 26th, they did not want to prove it for all. And the reason is they don't want to have reluctance on other vaccinations when people get side effects with their 3rd vaccine. Flu shots are extremely important this year. There are flu outbreaks in this country. We need to get people to get their flu shot. Measles, 2 million children didn't get their 2nd dose. We can't focus only on one infectious disease. We need to maintain control of the infectious diseases we already have. And this is going to be that transition phase. We're getting into endemicity with COVID. Let's start thinking about other infectious diseases as well.
All right. I want to ask this question because I wonder if long COVID will happen with breakthrough infections. I read something about that, but give us the details.
Yeah, this is a great question, actually. And I would encourage everyone, and if you don't mind me sending you a link, maybe you can post it. But there was just last Saturday, This Week in Virology. Just look it up on Google, This Week in Virology, episode 88, long COVID. And there was an extensive discussion about how 2,000 infectious disease doctors were surveyed, and they are not seeing long COVID symptoms, except for a slight loss of smell that goes away if you get an infection after vaccination. That is really good news. And why? Probably because you already have an immune response, so you bring down that viral load really quickly. The virus doesn't get to go and spread everywhere that can cause long COVID symptoms, and you have an organized immune response. So it doesn't look like we get long COVID with a breakthrough infection. And I really will give you a reference to if anyone wants to talk about it.
All right. Chris wants to know, should HIV patients working in retail get the booster?
Yes, I actually think that anyone who has HIV, who is around, like what you're just showing on the screen, people in retail, that is a population that I consider not always immunocompromised. Hopefully you have a good CD4 count, but I would absolutely boost people living with HIV, and we've done that at our clinic, Ward 86.
All right. We were talking about at what point are we going from a pandemic to an endemic. I wonder how big of a role do you think the Pfizer pill, right, which has asked the FDA for emergency use authorization, which treats COVID, is that a big part of it? I know the Biden administration today committed to buying enough for 10 million patients.
I think that pill is going to be huge. I think molnupiravir also is going to be huge. So molnupiravir is the nucleoside analog. Paxlovid is the name of the Pfizer pill. It's a protease inhibitor, and it brought down hospitalizations and deaths, prevented them by 89%. If you had moderate COVID, were unvaccinated, and got this pill within 5 days of symptoms. That's pretty profound to prevent severe disease in those who choose not to get vaccinated, or if we have a moderate breakthrough in someone who is vaccinated and more at risk, like an older person. I think it's going to be huge. It's going to play a huge role in endemicity.
This might be our last question just because of time, but Mark wants to know, will it become necessary to get a COVID vaccine shot annually like the flu vaccine? And I read that in some European countries, they're already ready to redefine fully vaccinated as really the booster as well, right?
Yes, that may be true that a 3rd shot will become something that people want. Again, differing opinions, they want people to get. However, it won't be a yearly shot. Why? The only shot you've ever gotten in your life yearly is a flu shot. And that's because the formulation changes every year based on the spike proteins of the flu virus that's there. We're not changing COVID-19 vaccine formulations because your immune system can adapt to whatever variant you see. So this should not become a yearly vaccine.
All right. Well, that is all the time we have. I wanted to talk to you about safe holiday travels and gatherings, but we'll have to do that next time. Thank you very much, Dr. Monica Gandhi.
You should do it. Okay, thank you. Thanks.
Coming up next, the longest partial lunar eclipse in nearly 600 years. We'll talk with astronomer Andrew Fracknoy about what that means and when and where you can see it. We're taking a short break on the air, but the conversation continues on Facebook Live and YouTube. All right, everybody, great questions today. Wow, you've outdone yourselves, and I appreciate all the questions. I could have done a whole segment, probably a whole show with Dr. Gandhi with just your questions. So sorry for the ones that we didn't have time to get to, but hopefully you got yours answered. Let's see. I'll try to answer some of these myself based on what I know while not professing to be a doctor. And you should never take my information as, you know, the word of medical gospel. Let's see. Ray, you want to know why is it when a person tested positive, why they can't test again after symptoms are gone? I don't think I've heard that you can't test again. I think after you finish your bout with the infection, I think you may have some quote unquote false positives for a while. Like by false positive meaning you still have some detectable maybe viral load or but you're not really infectious. So, you know, I can't speak to that, but hopefully you'll ask again when Dr. Monica Gandhi is on. All right. How many lives have we lost to COVID? Well, why don't we try to look that up all together? I think in the U.S. it's 765,000. Let's just see what it is around the world. I want to say 5 million. Okay, it looks like 5.1 million is where we stand right now. That is pretty mind-boggling in terms of pandemics that have hit our world in our history. Colette, you're most welcome. Happy to be able to answer your question or get Dr. Gandhi to do so. All right, 20 seconds to our next guest. Alicia, what was that you said about the event, 600 years? I thought you can see it every 2 or 3 years. Okay. You've probably been noticing gorgeous moony nights this week, but guess what? An even more interesting moon event will be happening in the skies tomorrow and Friday, and you don't want to miss it. Joining us now to talk more about the upcoming near total eclipse of the moon is Andrew Fracknoy, astronomy professor at the Fromm Institute at the University of San Francisco. Andrew, so good to see you.
Yes, nice to be back on the program.
I know, this is exciting. What exactly will be happening, and why is it a near total eclipse of the moon?
Right, so during an eclipse of the moon, what happens is that the moon and the sun are lined up in the sky, and you have a full moon. And if people have been looking out at the sky in the last few days, they've seen that the moon is almost full. And then just as we have a full moon, the Earth's shadow falls on the moon. The Earth gets between the two of them, and the Earth's shadow falls on the moon, and the moon goes dark. That's a total eclipse. We're not going to have a total eclipse. We're going to have 97% eclipse. So in addition to the moon going dark, as the picture is showing you there, there'll be a little sliver of light on the very edge of it, the southern edge of it. So this is a very democratic thing that anyone can see in the sky. Bernie Sanders would say it's for the 99%, not just for the rich people with good equipment. And so that's what's going to be happening late Thursday evening and early Friday morning.
All right, so what is the best viewing, I guess? You know, what hour of the night should I go out there with my binoculars, hot chocolate and blanket and everything?
There you go. It's really good also to take with you someone with whom you like to spend time in the dark, because it's a good shared event. So the best time to go out, unfortunately, is kind of late in the evening. The partial eclipse, the beginning of the shadow falling on the moon, starts at about 11:20, but it doesn't get to be really dark, fully dark, until closer to 1. So the maximum eclipse will be at 1:03 a.m. Friday morning. And I know that's hard for people who have to go to work or school the next day, but sometimes you have to make sacrifices for cosmic events.
Indeed you do. What if you just woke up a little early on Friday morning, say right before sunrise? Will you still be able to catch a pretty good view?
It's gone by then. The whole thing ends by 2:47 a.m.
Got it.
So really you need to be awake during those times when we are dying to sleep. But if you're a night owl or if you don't mind being sleepy the next day, I would say from about 12:40 to 1:20 is the best time.
Got it. I'll mark that
12:40 to
down.
1:20 a.m.
Okay, so how rare is this? I think I read that, every 2 to 3 years you could get, a total eclipse of the moon. But this one we said is unusual in that it's the first in 600 years. In what way?
All right. So you're absolutely right to make that distinction. Lunar eclipses are pretty common. We're going to have a total eclipse of the moon May 15th, 2022. That's the next one. So there's another one coming if you miss this one. So what makes this one rare is that the eclipse is happening while the moon is in the furthest part of its orbit. And therefore, the eclipse takes a lot longer than typical eclipses. It's going to take hours for the shadow of the Earth and the moon to move across each other. And so it is the slowest eclipse, the longest eclipse for 600 years.
Oh, well, there's a chance I may not be around 600 years from now, and so I'm just going to try to catch it this time. I wonder if the moon might take on, even in shadow, a bit of a color or tint?
You're absolutely right. So for a total eclipse of the moon, we know that when the Earth's shadow falls on the moon, as you're seeing on the picture, when the moon is completely covered, red light from the sun is bent by the Earth's atmosphere. The atmosphere of the Earth is like a giant lens, and it makes the moon red, as you're seeing right here on the picture. Now, this time we're going to have that sliver of light at the bottom, and so that means the red color may not be as knock your eyes out kind of thing, but you will still see the reddish color from the refracted or bent light from the Earth's atmosphere.
Got it.
That sunlight bent preferentially for red and not so much for blue.
Well, this will have to be a yes or no answer because we're almost out of time, but it's safe, right? You can just look directly at the eclipse.
Yes, absolutely. It's the solar eclipse that's dangerous. These are safe to look at, and everyone's invited to join in.
All right. It's exciting, and there's so much that it teaches us about our amazing world. Andrew Fracknoy, always great fun and great learning talking with you. Thanks so much.
Thank you. Nice to be with you.
All right, coming up next, some California school districts have said they will defy Governor Newsom's student vaccine mandate. Up next, we'll discuss the legalities of that with UC Hastings law professor Dorit Rice. We're taking a short break on the air, but the conversation continues on Facebook Live and YouTube. All right, everybody. We love Andrew Fracknoy. He is so amazing, knowledgeable, and so excited about science. And I hope you'll get a chance to go out there. At first, I thought it was like 2 nights because we said Thursday and Friday, but really it's Thursday night into Friday morning. So it is a 1-night shot. There you go. All right, take a break for a minute. Be right back. In October, Governor Newsom announced California will add the COVID-19 vaccine to the list of childhood vaccinations required for school, becoming the first state in the country to do so. Well, some school districts have said they will defy that mandate, which would have major repercussions. Joining us to talk more about this and employer mandates, UC Hastings law professor and expert in vaccine mandates, Dorit Rice. Professor Rice, thanks so much for your time.
Thanks for having me.
The school districts that have announced they will not enforce the student vaccine mandate are not in the Bay Area. Just to let our viewers know, they're in the Sierra Foothills and Shasta County for now. But let's talk about what defiance means. Would those school districts lose their state funding? Is that even legal to strip them of funding?
So right now, nothing is going to happen, at least in the near future. The mandate is not yet in place. If the school mandates go against a state rule, the state can, in some conditions, remove funding. But the mandate, the state mandate is conditioned on the FDA licensing the vaccine for 12 and up. At this point, Pfizer has not even submitted an application to license the vaccine. And once it's submitted, the review of the application is going to take a few months. So we're not talking about anything that's going to happen in the near future. And by the time the vaccine is licensed, we may be in a very different place. So right now, the defiance is not going to cost them anything because there's no mandate in place.
Yes, it could be months before this happens, but it is California's intention, at least this administration's intention, to put it in place once it has full approval, not just emergency use authorization for that age group, as you mentioned. But I wanted to ask, you know, since there are personal belief and medical exemptions anyway under the vaccine mandate, why does it matter so much if families have a way out?
So where it matters is in terms of the school's compliance. And among other things, it's going to matter to records. Without collecting data on whether people are vaccinated or unvaccinated, we don't have a good picture on what's going on in those schools. Even with open-ended exemption, one of the things a requirement does is make sure the schools have good data on whether people are vaccinated or not. People submitting an exemption are on record that their children have not gotten the vaccine, and that helps the school know what's going on and helps the Department of Health know what's going on in case there's an outbreak. That's important information.
And I should point out to our viewers that, look, you know, if the state carries out its threat to take away funding, it's not like all or nothing. It's per pupil, per student who is not in compliance that you don't have the data on, that you're not checking on. But I want to say that approach that those school districts have said, we're going to defy that, that contrasts sharply with school districts like Oakland, right, which is the opposite, where students must get the shots, they say, by January 1st or be forced to return to distance learning or homeschooling. Is that approach legal by the school district?
It's unclear. The question here really is a tension between two legal principles, and we won't know which one wins until it's tested in court. One legal principle is that historically it's the state that requires vaccine, and there's a whole state law addressing which vaccines are required. And there's an argument that districts can't go there alone. The other legal principle is that districts have broad authority to regulate their own district, including for safety. Which of these is going to be more important is going to depend on the court. There are now cases in relation to the Los Angeles mandate and the San Diego mandate, although those cases are not well argued, so they might not fully expose the issues. I expect any mandate will be challenged in court, and the court could go either way.
Okay. Let's talk about the workplace now. The Biden administration has set a January 4th deadline for the vaccine mandate for companies with over 100 employees to take effect, although a court has blocked it for now. So, you know, we don't know if this mandate will ultimately prevail, but I wonder, generally speaking, is mandating vaccines in the workplace legal?
As with other things, so there's a debate about that. My view is that this builds on historical precedent of regulating safety in the workplace. OSHA has extensive power. It has some very broad regulation in the workplace, for example, sanitation regulations, and you can see this as fitting that. On the other hand, OSHA is doing this through an emergency temporary standard, and the emergency temporary standard have to meet a very high bar of showing there's a grave danger in the workplace and the mandate is necessary. But if a global pandemic that's killing over 1,000 people in the United States is not a grave danger. It's hard to think of what is. So there's at least a very good argument that the OSHA emergency temporary use standards, emergency temporary standard is legal. Although there are arguments the other way. As you've mentioned, one circuit court have stated
if you are an employer and you don't mandate the vaccine, let's say you're smaller than 100 employees and you don't have to, so you don't. If you have an outbreak on site, could you be on the hook to pay?
You could be on the hook in at least two ways. First of all, your own employees, if they get COVID on the workplace, can use workers' compensation. It's a work-related industry and they can sue you for compensation. And second, if a customer got COVID-19 and can actually show that it's from your facility, that's not easy because it's often hard to trace where you got the COVID-19. But if it can be traced to your facility, you may face legal lawsuits over that.
All right, UC Hastings law professor Dorit Rice, please don't go away. We do need to take a short break on the air, but let's continue this conversation on Facebook Live and YouTube. All right, Professor Rice, we are done with the on-air portion, but we can finish up our conversation here on our streaming platforms. I wanted to see what you think about, the vaccine deadline for TSA workers at the airports. That's next Monday, just as the Thanksgiving travel week is ramping up. I'm sure you're following this. Now, we don't expect mass firings from day one, right? Because I think that is the fear of travelers, that there won't be anybody and then there'll be mass delays. But it's not just like the deadline is here, you're fired, you're out of here.
I think it depends how the workers are handling it. If a lot of them, for example, submitted exemptions, religious exemption, it's probably going to take the TSA some time to go over it. And I expect many workers have filed religious exemption rather than just give up starting. So it's not necessarily deadline and you're fired. Many employers, and not just the TSA, are going to try and work with their employees and convince them. And I will add that some employees that are reluctant to vaccinate may, when the deadline comes, change their mind.
Right, right. A lot of people ultimately want to keep their jobs, right? I want to ask if you've seen a huge range of how strict employers are when deciding on whether to approve that religious or personal belief exemption, because by the very nature that it is personal and a personal belief, it seems like there's a lot of room for interpretation, and employers could go super easy on that or super tough on that.
You're exactly right about the range. So we are seeing things from employers that accept any exemption, anyone files an exemption, to employers that accept none, and sometimes in ways that can get them into a lot of trouble with courts, into in between. So some of the ways that would work for employers to legitimately assess exemptions are, for example, create a process. Yale, for example, created a committee with a theologian, ethicist, and I think a doctor, to address each religious exemption and see if it's valid.
Thank you, Professor Rice. We are out of time. Thank you so much for your insight.
Thanks. Sorry.
Thank you so much for joining us on this interactive show, Getting Answers. Today, we talked about booster eligibility and COVID vaccine mandates. Plus, you can see a partial lunar eclipse tomorrow night, near total, actually. We're here every weekday at 3 on air and on live stream answering your questions.